Namaskar, welcome again to Ek Dose Gyaan, Ek Dose Muskaan. Today we talk about cough and cold. First of all, I'll be reciting a poem, a romantic or rom-com poem by Vishal Bharadwaj, the well-known filmmaker and musician. Vishal ji writes, लग गई मुझको तू सर्दी की तरह, जम गई सीने में जाड़े की तरह, आंखें तेरा नाम खासा करती हैं, पलकों से छींके भी मारा करती हैं, बंद कानों में टपकता रहता है एक मध्यम सुर तेरी आवाज का, तेरी खुशबू बह रही है नाक से, लग गई मुझको तू सर्दी की तरह, जम गई सीने में जाड़े की तरह. विशाल भारद्वाज. Let's talk about cough and cold. One common mistake that is made by patients and by doctors is to give second generation antihistamines in viral URTI. There are two types of sneezings and coughs that we see most commonly. One is allergic and one is viral. In allergic URTI, the second generation antihistamines work well. In viral URTI, it is the first generation antihistamines that you must use. The first generation antihistamines include phenyramine maleate, that's called Avil, chlorpheniramine maleate, CPM, and des-chlorpheniramine maleate, which has a brand name called polaramine. So if you have a viral URTI and if you want to symptomatically treat that with tablets, use I would say tablet CPM or polaramine. Polaramine 2 milligrams is equal to CPM 5 milligrams, CPM 4 milligrams. So you can use either of them 3 times a day at the cost of some drowsiness to the patient. I also commonly use nasal sprays. Again, a plain azilastine nasal spray will not work in viral URTI. I would typically use a steroid nasal spray. Steroid nasal sprays are useful both in allergic and in viral URTIs. So you can use them. And you can also use, of course, xylometazoline or oxymetazoline nasal spray for a temporary period for relief of nose block. Remember, prolonged use of xylo and oxymetazoline can cause rebound congestion. In allergic rhinitis, second generation antihistamines are better and with lesser sedation than first generation. The second generation most commonly used, of course, as you know, are loratadine, desloratadine, cetirizine, levocetirizine, and fexofenadine are the commonest use. One suggestion here is this, that if you use fexofenadine, brand names Hista-Free or Allegra, I would say 180 milligram once a day is not a very effective dose. So if you do want to use either 120 BD or in a heavy set person 180 BD of fexofenadine. Thank you so much.